Welcome back, YouTubers, to my channel of an everyday life of an Aspie. If you're following me right now and you're new to my channel, I welcome you with open arms. I'm Aspie and I'm all about creating mental health and awareness, also sharing my life stories along with the way of tips and advice for you guys of the know-how on how to rule out anything that can be of help to you. So without further ado, guys, basically I have been doing some of the anxiety series at this point of time, which obviously has been covered of how to overcome anxiety. They were broken up into 3 parts, so this is part 3. As I said before I begin this is a disclaimer. I'm no medical doctor. I'm just a normal everyday Joe Blogs, just minding my own business, trying to sort out my own life, and hopefully with these tips and advice that I give to you will be of value to you, as well as if you see any signs that are ranging from what I discuss, seek professional help or attention from your professional. So let's begin this one, which is method 3, looking into long-term solutions for how to overcome a panic attack. So step number 1 is talking to your doctor. As we all know, basically doctors should be knowing what is in the know-how if we let them know of what's going on. So if you haven't done so already, I recommend maybe to go to your general practitioner and ask for help and actually see if you can rule out what's going on in your mental health state as well as just your physical state. If any panic attacks do start to affect your everyday life, like for sure it does, obviously, as I mentioned before, for these panic attacks and anxiety issues, they do debilitate our lives and just tend to stop us in our tracks of our everyday living. So therefore, obviously, outside help is necessary. Prior to your appointment, however, when you do decide to make an appointment with your doctor, be sure to jot down anything that is of value to you. Basically, maybe your symptoms, your medical history, and also any medications you may be taking at that point of time. You should also think about the possible causes that is triggering off your panic attacks, so to speak. So like, here's the example here. A classic one would be your past traumas that you have experienced in the past, be it from some form of abuse or drug addiction or what have you. They may fuel your panic attacks along the way. Your doctor may also probably perform some everyday things such as your physical exams, as well as some blood work to rule out any other underlying medical issues before they can rule out this kind of condition. Depending on your doctor's area of expertise, however, they may be able to perform a psychiatric evaluation. If not, they can recommend you onto a counsellor or psychologist. Panic attacks can obviously be effectively treated through therapy, as I've mentioned so many times before in the past videos. If you haven't done so, I recommend to check some of these videos that I'm going to link either in my description or not information, but on my cards will show up somewhere on the screen. So step number 2 is exploring therapy. Therapy can help treat panic attacks, however, in many cases. Working one-on-one, however, with your special therapist can help you develop the coping techniques that is necessary to live your life or to ward off the panic attacks. There are several different types of therapies, however, that can be used, as I mentioned. Psychotherapy usually focuses on your emotional response to these issues that do arise many times and again. A therapist will talk you through some effective strategies for coping with panic attacks. If you have any panic disorders, cognitive behavioral therapy, or CBT as I abbreviated short, may be of use to you. This is a type of therapy which you can learn to recognize and change any damaging thought patterns that you have in your mind. As I said before, most of the time for some mental health disorders, some of it is just to how we feel inside our wiring of our brain and whatnot, and it's just a matter of just how we cope with it based on our everyday choices. Number 3, ask about any medications that's needed to be taken. In some cases, panic attacks can be treated with some form of medications. If you are diagnosed with any underlying mental health issues like panic disorders, your doctor or even your psychiatrist may be able to recommend some medications. Anti-anxiety medications and antidepressants are often used to treat panic attacks. Certain heart medications may be used to treat any irregular heartbeats associated with panic attacks. Benzodiazepines are mild sedatives, however, that can be used when a panic attack is happening or beginning to happening. While they can be effective, however, they can also be habit forming, which I mean here is obviously some form of medications can be addictive than others due to the chemical compounds that is involved in this. If you had any issues in the past with drug addiction, however, benzodiazepines will not be the case to be used, however, in this scenario. Number 4, if you are prescribed medications, be sure to ask your doctor any questions you have about taking these meds, because obviously, as I said before, they're in the specialised field that they should know and the know-how what's going down with us, no matter what. Your doctor should also explain to you any side effects of these particular medications you may experience. Stick to a treatment plan that they may give you, obviously, because whatever plan you choose for your treatment, you need to stick to it, or else, dire consequences will follow. Sometimes, in this case, sometimes when it comes down to some treatment plans, some people want to go cold turkey in a cold rush, and obviously, that's not a good look. Believe you me, I've seen it once before with a few people. But to be assured though, to prevent any attacks from occurring, long-term treatment is usually often necessary. Take any medications you are prescribed and follow your therapist's advice for these, and then you're sure as hell will be hopefully on the mend. Well, not on the mend as such, but being on the right way of recovery. So tips here just to bear in mind also before I end this is step outside and get some fresh air. Sometimes they say good breath of fresh air can come in handy, obviously, for us. We can't always be confined in a cocoon, obviously, indoors, obviously, but then again, it's just depending on how we feel in our days and if we feel to, no pressure there. And tip number 2 there is staying connected to the people around you. Obviously, we know how tempting it may be for us to just be us, living in our own worlds, not wanting to reach out, sort of thing, even if we are afraid to leave our home due to these panic attacks or anything of this matter, sort of thing. Even though sometimes it's good to have some family and friends around or someone to talk to, basically, as well as a form of support. As we know, friendship and support is crucial and beneficial. Everyone needs people around them to help them laugh and actually just, get on with their everyday living. Well, this basically ends the 3rd part of how to overcome panic attacks. Give me the like for thumbs up for support and engagement. Comment below of anything that may be of use and value to others, be it maybe how you cope with these everyday situations. If I've missed out anything, feel free to comment below also. Subscribe to my channel if you haven't done so we can let you know in the know-how if you see this little notification bell ringing or what have you. So feel free to actually follow my social media sites. As I said before, I'm creating some new social media platforms, so they'll be listed below also in the description. So, and all for the do, guys. Thanks for watching. Do what you love what you do. Aspie signing out, and I'll see you all again soon.